Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host. And I'm delighted to have with us today the team from The Big Plan, Carey and Batya. Welcome to the big show.
Thank you, Ray. Thank you so much for having us. We are very excited to be here.
I don't think you're as excited as I am. In studio, ladies and gentlemen. This is pretty cool. So how'd you guys get into this racket? You know, did you grow up and say, I want to be in insurance? Or how'd you find your way here?
Isn't that what everyone does when it comes to insurance? You go to school, you go to elementary school, say, I'm running into the insurance business.
Never.
I think there's not a person in the insurance business that's not there because they knew someone in there, unless by fluke they were pulled out of college or something happened where they were able to all of a sudden be like, hey, you want to try the insurance business? And we're like, what's insurance? No one knows insurance.
So if we go to a local preschool and we get the kids around together in circle time and we ask for a show of hands, what do you want to be when you grow up? You don't think we're going to get any takers on insurance?
You absolutely will. Your children, my children, her children, and anyone's children who's in insurance might say, my daddy does this, my mommy does this. And they'll all want to be in insurance.
That's
Other
hilarious.
than that, everyone will be like, huh?
It's so true. So seriously, how'd you get here?
Fluke.
Okay.
Like most people.
Yeah, talk to me.
I'm a psych major, can't you tell?
Now I'm really worried.
So, most people don't go to school for insurance. It's very rare you find that unless you have a parent or a sibling or a close friend in the insurance business. So I was actually in between jobs. This was back in 94, 95. When I got into the business 30 years ago. Wow, 30 years ago, yes.
Yeah.
Yes, you were much younger than I was. We won't talk ages, but...
What do you mean? I've been doing this my whole life.
Right, exactly.
Yeah. Your whole life.
But you weren't born 30 years ago.
No, I was not born 30 years ago. No, I was.
See? Good.
Barely.
All right.
And my father came across an old friend of mine who was in the insurance business. I was looking to get into the insurance business at the time. Connected with a company by the name of Primerica.
Oh, boy.
Does that ring a bell at all?
It does indeed.
Travelers, I think, owned a company, and it was buy term, invest the difference. That was their motto. Their motto that they always used to talk about, buy term, invest the difference. I never actually... I shouldn't say I never worked for them. I think I did 2-3 weeks. My father came across a good friend of mine. He's like, you got to come with me. And I got into the insurance business in 95, really on the life side for a few months, but immediately transitioned to benefits at that time. But we're talking, this is post-school. This is after finishing high school, going to school in Israel for a couple of years.
Oh, wow.
Going to some local college in New York, both Touro College and Shar Yashuv. And then, married at a young age at 94. And this was 95, like I said, 30 years ago. Yes, you know my age now, 51. And been in the insurance business ever since.
Wow. That's crazy. And, so excuse me, we have some parallels there. I also got married young. I was married in 91. I'm 58, I'm a little older than you are. And just like you, I never thought of insurance. It was not even on my radar. No one thinks of insurance. It was a friend of mine who introduced me to Aflac back in the day. And so in 2001, I was at a transition. I was working as a manager for B&H Photo Video back then. And I was looking for my next thing.
24/6, B&H.
Yeah.
B&H, Baruch Hashem.
Baruch Hashem. Yes. God bless. And so I started on 17th Street when they were, under 200 employees. I was the token goyim. And, they hired me. I was like one of the first. And fast forward, and the company started growing and growing. And, shout out to B&H. They do a phenomenal job. They're really good at what they do. But I was looking for something more, and I started a .com the .coms were starting to blow up in the late 90s, early 2000s. It was right around the time I started a company called VideoAuthority.com. One thing led to another. I was undercapitalized, overextended, had to pivot. My friend said, hey, you'd be great at Aflac. And I was like, what is Aflac? There wasn't even a duck back then.
Right.
Just barely. They just started with the duck. And it was insurance. And I said, no, thank you.
Right.
Not interested. And one thing led to another, and most people really don't aspire to be insurance people. But to tell you the truth, in hindsight, it's one of the best decisions I ever made. It's a great industry, met a lot of great people. It's very lucrative if you're good at what you do and you know what you're doing. And yeah, here we are. So
just to add another story in there, 94, 95, when I was in between jobs, there was a local bagel store opening up in Cedarhurst, and they offered me a managerial position, $40,000 a year, which was huge. And I remember speaking to my father and my uncle, and he's like, no. I'm like, $40,000, I make nothing now. I mean,
Right.
like, to me, it sounded like the world.
Right.
And they're like 4 a.m. every day. You got to get there. Yes, your day ends at 2, 3 p.m. possibly, but it's not the life you want. And during that transition was when I came across the insurance business, which took a few years for it to connect. It's not like you get in insurance and everyone says, oh, he's insurance, he must be doing well.
Yeah.
It doesn't happen that quickly.
No, and it not only does it not happen quickly, but there are an awful lot of people that don't make it in the business.
Correct.
So it's kind of a it's a numbers
Yeah.
excuse me. It's a numbers game, and only the strong survive, but the strong typically do very well. At least that's my experience.
Yeah.
I'm getting a lot of knowledge over here because I've been married also, since 1990 something, and been in the insurance game. Yeah, not too long,
But
actually.
It's been a few years.
It's been a few years, and Carey will be the first one to tell you that it took a lot of convincing to take the position because I was so hesitant about doing something like this that I know nothing about. I'm not from here originally, so when I hear insurance, for me, it's socialized medicine. Everyone has insurance, and you just get it. And over here, it's sponsored either by your employer or by the government, and you actually are required to purchase your own insurance. So that was a huge pivot for me in understanding that. Again, not coming from the country. So, you guys are going back. I'm like, I've been living in the United States for, I think, only 16 years.
Before that, Venus, I'm guessing. Men are from Mars, women are from Venus.
Exactly. No, I'm originally from Switzerland. So
wow.
Europe, and then
Neutral
completely. And then after that, moved to Israel. And I lived there for a majority of my life. And then coming to here, it was a big change for me. Also went to Queens College for the knowledge, shout out to Queens.
All right.
And I actually studied medicine. So I had a different aspect into the health field than now I'm looking at it and understanding how it actually functions and the basis of certain things and how things get billed and the explanations of what you have to actually do for not just for your employees, your clients, and also the patients going through the entire process. And I found it fascinating. And I think that's when it clicked for me that this is something that overall is a huge component to insurance.
So that's an interesting pivot. You went from studying medicine.
Yep.
What did you want to be?
Physician assistant.
Oh, wow.
Yeah.
I just interviewed my cousin Charlie DiMaggio. He was a physician's assistant for many years at Elmhurst Hospital in Queens, division of Mount Sinai. And, then he went on to, other things.
Right.
But that's quite the pivot.
It was a huge pivot for me. I mean, again, I when I went to Queens, I actually studied anthropology. And from there, I had, a post-bac in biology. And I was just working my way in order to get everything through to get to that point where I'm in PA school, and just took a turn. Started actually getting into the nursing home industry. And from there, managing medical offices. When COVID broke out, I was assisting with that. I worked for Pro Healthcare, part of Optum, managing some offices, and then transitioning from there to a staffing industry where I was actually placed inside Carey's office as an employee of another company. And the constant back and forth that was going on over there, and when this whole concept of, ICHRA came out, and just hearing it really drew my interest into it. And I think that's
Yeah.
hats off to all those people there.
So Carey, it sounds like you poached her. I mean, if I'm just being, being
I have
honest.
a partner here named Judah. I think it was him.
Judah, we'll blame Judah.
Blame Judah on this one.
All right. So ICHRA sounds like a disease, frankly.
Yes.
Exactly. You hear us coughing a little bit. It's that time of year. Apologies there.
Yeah.
What is an ICHRA, and what should people know about it? Should people care?
So ICHRA stands for Individual Coverage Health Reimbursement Arrangement. And what it essentially is, it is a stipend for your employers to now provide to your employees to offset the costs of plans available to them on or off the exchange in their local marketplaces. It's a stipend. Here is $500. Find yourself a plan, and I'm going to reimburse you the funds that I allocated towards you. And that's really what it is.
Right. It gives the employer the opportunity almost to leave the insurance business and start, anytime a consultant sits with the group or the employer, the HR, hey, what should we do with the copay? What should we do with this plan? Should we take a high deductible, a low deductible? Let's offer these 3 plans. Who's the insurance company? What's the network? ICHRA is, hey, Mr. Employer, Miss Employer, let's back off. Here's some money. Here's a fair amount of money. It still has to meet ACA requirements. And now let's go purchase a plan on the exchange. But most employers would be like, 1 second, or employees, they'll get the $500 and they'll be like, okay, now what? Who's helping me? How am I getting guided? How do I choose between 150 plans? That's where it gets a little bit complex. And there's platforms out there, like the platform that we created called the Big Plan. And the Big Plan is a platform, an end-to-end solution. And again, you're always going to hear this. It's funny, the more I'm out there with all the big guys and all the other competitors out there, we all talk about this end-to-end enrollment platform. So we all have an end-to-end enrollment platform. This one does a little better here. This one does a little better there. I think it's interesting that our key to success and what we've seen so far is the 30 years of experience that I personally have had. You can't really transition that so quickly into technology. You could, there's a price for everything, but I think understanding the experience that I've personally had with employees, employers, HRs, just understanding the whole back and forth, we kind of converted that into the Big Plan and put our platform that when the employee's looking at it, or the employer or the consultant or anyone else, they're like, wow, that was thoughtful. And that's what our goal is. And we're not a closed shop where we're saying this is how we do it and we're stuck to it. We're open to say, hey, that's a good idea. Let's incorporate that.
So when did the ICHRA become a thing? Because I feel like it's something that's catching on now, but
Right.
it didn't happen overnight. And what do you see in terms of adoption? Do you see more people adopting this as a strategy now?
Yeah, so I'll answer that first, and then you can follow
Okay.
afterwards.
Sure.
But I would say in 2019 is really when it didn't go into effect till January 1st, 2020, but 2019 it got approved by the Trump administration. And prior to ICHRA, there was something called ICHRAs. ICHRAs were the ICHRAs for small groups. Any group between 2 and 50 employees could have a ICHRA. That means rather than the employer be fined for telling their employee to go find a plan on the exchange, they were allowed to give them an allowance, a stipend to go purchase a plan on the exchange. In 2019, 2020, ICHRA came about, but what happened 2 months later? COVID. So complete silence for 2 years. So from COVID was it March 16th or whatever that date was
Yep.
when COVID officially came and everyone worked from home and everything else. This was the last thing on anyone's horizon, except for our company, because when we built the company, the law just changed. We started building this in 2019, 2020. The idea, it was completely, nothing was going on. And it wasn't for ICHRA initially when we built it. It was more for the individual market. We always get, as consultants, especially in New York, other states it's different because you can write individual business. in New York, there's no individual market for consultants to write on.
They just send you over to
Yeah.
go to the exchange
Go to
and
the
find
exchange,
yourself
find a
something.
plan.
Right.
But how many times do you get that call? Hey, Ray, I got a friend. They're looking for a plan on the, can you help them? You can, but you can't. You really don't know much. So we say, hey, let's build a platform to help that individual find a plan. We'll partner up with various actuarial firms, software companies, see what we could build, kind of like the iPhone. The iPhone, not every part is built by Apple. They find the best consumers out there. They put it all into one mechanism. The big plan tries to find the best mechanisms out there and put it into one system. So we created that system. With that system, it's helping the individual. But then when the ICHRA model changed and it said, hey, this is allowed for large group employers, right away, stop the presses. This is the market I know. I understand group market. I don't know the individual market. So we transferred and created a platform for the ICHRA market. That means we have to manage the employer's contributions and figure out how much do they contribute. We have to manage the employees' deductions. We have to pay the carriers. We have to help them decipher between the plans. There's so many different things that take place that we built. And back to your original question, it was silent for a couple of years. And even now, I would say we're exiting infancy stage, but we're still there. When you speak to your common consultant or broker and they ask you about ICHRA, right away, there's a certain no, we don't do that. That's the exchange. The networks are small. This is not good. It's only in-network only. That's correct. There's some pros and cons, but most of them have no clue of what they're talking about.
Yeah. That's what I find as well. It's an immature model.
Very, very immature.
Right. We're just at the beginning. And I don't know if you agree with this. It's not a one size fits
No,
all.
it is
I
not.
think you do agree with that. I almost approach it as, in case of emergency, break glass. I think it's an excellent fit for groups that have horrible claims experience, that are faced with
High renewals, low participation,
correct
Blue collar.
blue collar.
all of that stuff, make it a lot more attractive. And if you find yourself in that bucket, you really have something. But I do think that, and I'm sure you spend quite a bit of time educating
Yes.
your client, and that's
It's not just
that's
educating the client.
the broker,
We have
and
to educate the broker, then we have to follow up and educate the client, then we have to follow up and educate HR. It really is still new to everyone, and making sure that they understand that what we're providing them is an actual benefit to them, because they're used to seeing that even, upon renewal, they're seeing small hikes within their premiums as well that they're contributing towards their plan. And now we're giving that choice back to the employee. We're empowering them for them to make the best informed decision that meets their individual needs and their individual wants. Hey, you want to sign up for Aetna? We'll find you an Aetna plan that's available in your local marketplace. You want United Healthcare? You can have 100 employees on 100 different plans, but they are able to customize that choice for themselves.
right. So just to step back a minute, what people are used to when you work for an organization is my employer provides us with health insurance. And typically, if it's a large organization in particular, there are several options. But everybody that chooses that option has the same coverage. And that's what folks are used to.
Correct.
Now, the trouble is, over time, we've seen premiums increase and benefits erode. So we're paying more for less than we ever have before, right? It's just
Definitely.
crazy how much. I mean, you can find
it all the time.
on the individual exchange in New York State. If you want the quote unquote best of the best United Healthcare Platinum plan, you could have the privilege of paying over $70,000 for family coverage, right? For one plan.
Yeah.
Which is, what do you say to that?
Yeah.
That's insane, right? But with the ICHRA now, it takes an employer that had their back up against the wall with no other options, because they have to provide this benefit to keep competitive and keep their lights on and run their business. It's almost not optional, right?
Right.
But their claims experience is crushing them, and they're getting hit with these double-digit increases year over year, the ICHRA is really an incredible life preserver for those folks, because now they can send their people out to the exchange they can define a contribution and, go ahead, Batya, go pick any plan that you want. Here's your contribution. It's a stroke of genius.
Something you said earlier on, it is a different psychological change for both the HR and the employee. Today, an employee gets a job and says, so how much is my plan going to cost? And you say, okay, your contribution's $100 for plan A, $200 for plan B, $300 for plan C. In this case, we're giving them an allowance. We don't know what their cost is going to be. So first of all, that change is complex. There's a learning curve when you move on to ICHRA. We are the quickest to tell all the brokers that come towards us and employers, you're not ready yet. This is not a good fit.
Right.
The last thing we want to do is write business that's not going to be sticky business. We want to write business that's going to make sense for the employer. It's going to make sense for the employee. And it's very complex if you don't have the proper support from the human resource department of that group, or they're not willing to change or listen. Try someone else, not us.
Right.
It's not going to work, because when all the groups that we've moved over, and at this point it's been hundreds, I don't know about 1,000 yet, but close to it, but hundreds of groups that we've moved over, that sometimes initially it's challenging, but it's getting easier and easier because ICHRA is becoming something that employers are hearing about, employees are hearing about it. Hey, I could buy a plan that makes sense for me. Hey, if I'm 51 and you're 58 and Batya is under 35 or 30 or whatever Batya is, we have different needs. We're at different place in life.
Yeah.
So my needs are different than her needs. If she has a 6-year-old and I have a 20-year-old, it's different needs.
Right.
So what's nice about the concept is when the employee understands, one second, we're not trying to put you and find a plan that's not going to make sense for you. On the contrary, what works for you and your family? Here's an allowance. We're giving you this allowance whether you buy the 3 that you choose or not the 3 you choose.
Right.
So it really, employees learn to appreciate it as they're going along. If they know they're having a baby that year, they're going to take a plan with very low deductible.
Right.
If they know they're invincible, they're going to take a plan with a high deductible catastrophe type plan.
Right. No, and that's where you guys shine. I think your technology is tight. And, we have a client with you now. There was a vendor that we had before that did a fair job, but I got to tell you, it's a night and day difference. And I'm not saying that, because you're here and to blow smoke. Part of, I think, the job of any good healthcare consultant is to vet the market. And sometimes you could really only know how good a vendor is when you've had an experience with that vendor. People sling mud all the time, and they tell you how great they are and how lousy the competition is, right? You hear it all the time. But where the rubber meets the road is, okay, it's fine when everything is, rainbows and unicorns and the sky is blue and smooth sailing. That's not the test of whether or not you're a good vendor. The test of whether or not you're a good vendor is when the stuff hits the fan,
right.
Are you there? Are you backing up your word? Do you have your clients back? And that really is what I think separates the good consultants from the not so good consultants. And my experience with you guys thus far has been tremendous. The technology piece is interesting, though. Are you a tech guy? Where did you when did it hit you? And just take us back, what were you doing just before? You mentioned you were in the benefit space. Were you voluntary benefits? Were you a traditional insurance broker? And when did the light bulb go off and you read the New York Times article that said, ICHRA, this is it. This is what we're going to do.
Right. So to give you a little bit of my history in the insurance business, it's not that exciting. I've been pretty much doing the same thing for 30 years.
Exciting. This interview's over.
Right.
I love it. I happen to love the industry. So I've been in the benefits business pretty much, we're going to say, kind of self-employed most of the time. But it's interesting when I say self-employed. The initial people that I started working with back in 95, 96, I stuck with almost throughout my entire career. So, I worked with a group. At the time, it was called Harbor Group at the time. And I was a 1099. I was their benefits guy. And I still handle some of those very large clients today. I don't know if I should be saying the names or not, but some of them are public companies that I still handle today back from the late 90s, early 2000s. I've had these clients for 20 years. They have 500, 1,000, 2,000, 3,000 employees. So at a very young age, I had to learn the business really quick because my mentors at the time were very successful people, and I just held on to their coattails and took all their smaller business, whether it was brokerage firms, any type of business that was coming my way, I took. And I would say in 2002, 2004, kind of incorporated my own business at that time, and built that up throughout the time. With that, there was transitions. NFP bought not when I say ours, I was just a 1099 guy. I'm not coming here to say I own the place, but bought out the firm I was part of, but I was part of them as a 1099 for years. But kind of just building my own business on the benefit side and on the property and casualty side, which I had a very large book for many, many years, building that up. In 2012, again, my initial company is called Preferred Services Group. And in 2012, I opened another company called One Cap Services. One Cap Services is a full property and casualty firm that I started with the same person that I was working with in 95, 96. He was the VP of running property and casualty firm for this group called Harbor Group. And he was part of NFP. And in 2012, him and I created our own company, One Cap Services, with two of us. And fortunately, this March of 2024, we were acquired by Hub International. So Hub International, which I'm part of now, I wear two hats. And I know that sounds funny, but not just the yarmulke on my head. So I wear three hats. One is Hub acquired our full consulting property and casualty firm, our full consulting benefits firm. I'm still part of the Hub International and run the 50 employees that were part of my organization. And at the same time, I would say in 2019, 2020, while I had those two companies, I started a third company. The third company was called The Big Plan. The Big Plan was, like I said, it started with the individual market, know nothing about tech, but raised a few $1 million, some friends and family, and have put in, millions of dollars into this company and hired the people that are the techies. I've learned a lot about tech. I learned a lot about marketing. You can ask me, well, what's the big plan? What's our squirrel? Ask my youngsters in the company of what that is. But,
Wait a second. Is that like a children's story or something like that?
You would think so.
Right?
You would think so, but it's not. It's
Biggie the squirrel.
Biggie the squirrel. But, we get a lot of...
Well, tell us about the squirrel.
Do you have what to say about the squirrel?
It brings intrigue. I think that it's something so out of the box, out of the ordinary, to look at a company where you're so used to seeing all these glitz and shine and everything, and we're bringing it back to, well, what's that? Well, now we got your interest. Now you're going to ask us.
Interesting.
And with the name. What's the big plan?
So the squirrel is part of your marketing. It's part of the logo and the entire marketing design. That's brilliant. So it's very, very different.
We definitely were not shy to invest money into our marketing team, into the company that we hired. Ari Merck, and I'll give you a little plug, in Hollywood, Florida, who we spend a lot of time with, and he dissected our brains for hundreds of hours to come up with the look of the squirrel and the name, the Big Plan.
Interesting.
And so while I was running the full PNC firm, while I was running the full benefits firm, I was building this other company. In the beginning, it took a tremendous amount of work for me. Then it was just raising a few bucks, put the money in. I was, while technology was being built, I hired the right people to handle the technology and to, deal with that. Fast forward a couple of years later, the technology is built. Now we got to launch, and Batya coming into the firm was, Batya's main focus was, broker relations. How do we get to brokers And it's all relationships that I've had. So it's whether it's sales reps from insurance companies, brokers I've known for 30 years, of guys, you got to learn about this. This is something that if you don't know about, you will lose a case. The same way back in the PEO days, you lost a case or two. Back on HSAs and high deductible plans, brokers were scared to run to it. Learn about it. It doesn't mean it's the right fit. It's not a one size fits all, but it does work for a lot of situations. It works for that low income,
low participation,
high turnover, employers that don't want to deal with the high claimants anymore. Historically, if you have a company that's grown, they start with your small group, then it goes to fully insured, large group. It gets experience rated. Some of it is credible, some of it is not credible. Then we go self-insured. On the self-insured, you choose a network. Now we don't choose a network, we go RBP, reference-based pricing. Hey, maybe we could pay less with using reference-based pricing. But if you still have an enormous amount of claims, even if you're paying 150% of the Medicare reimbursement rate instead of paying 300% or 400%, where do you go now?
Right.
So back to, even though in reality the exchange is technically a self-insured product, it's treated like a fully insured. No employers getting money back, no employees getting money back. It's treated and looks and runs like a fully insured product. And now the employer kind of exits that market and they don't have to deal with, what do I do about these claims? And not only are the claims so high, the renewal becomes so high. Now you're tied into a place with 24 million other people. Every state's their own market. Actually, 35 states are under the federal and the other states are under the state mandated.
Not 34.
34. Oh, Georgia just left. Georgia left this year.
She's here to keep you honest.
But at least I knew what she was talking about. It kind of messed us up a little bit with Georgia. But
so wait, go back a second. And what do you mean by the exchange is self-funded? You lost me there.
People are very, when you look at the exchange, again, it doesn't mean anything to you, but technically there are PCORI fees. You know how there's something called PCORI fees that are involved in self-funded plans? To my knowledge, I don't know this 100%, but I know this 90%. The plans on the exchange are technically self-funded plans. They're not fully insured plans. However, for the employer's sake and the employee's sake, how they run, to my knowledge, exactly like a fully insured. And the reason I say to my knowledge, and the reason I'll always be a little doubtful, ICHRA is infancy. It's new. We don't know. Everyone talks about what's allowed, what's not allowed. Has anyone seen fines yet? Not necessarily. Will there be? Probably. But, when you see fines, even now with regular ACA, they're 3 years in the rears. This hasn't begun yet. This is the beginning of a new era of health insurance for the U.S.
So,
but self-insured is technically, to my knowledge, what how all the plans are set up.
Interesting.
Whatever that means.
Okay, I'll let's roll with that.
Yeah.
This episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. Did you have an oh shit moment when you invested all this money and, in technology and ramping everything up and then COVID hit?
No, because we were just building. We weren't launching at all. At that time, we were just building. So I didn't have high overhead. I had high overhead for technology. So technology was costing hundreds of thousands of dollars, but I employed 2 people, 3 people. So it wasn't like I had a team of 10 people.
Yeah.
I think today we just hired 3 people in the last week. I think we're up to 20 employees right now. And I'm not talking brokers, W-2 salaried employees that work in-house.
Not including the tech team.
Not including tech.
Not including the tech team. The tech team's another 12, right, or so?
I think
14?
they're more.
Yeah, not including tech.
Right.
So I'm saying in-house people that are working. So now, the change, what we saw in this past open enrollment for January 1st, 2025, off the charts compared to what it was the previous year. So I would imagine not just us, but the other competitors also, everyone has doubled or tripled their business in this short period of time because it's really a solution for employers. Again, it's still expensive. The plans on the exchange are still, in New York especially, it's $600 to $1,400 a single.
It depends. It's anywhere between 500, and I think the max we've seen for a single is around 828, and that's the most expensive plan for what we have to do in terms of.
You're talking about silver, but I'm saying the platinum plans are $1,400.
Oh yeah, the platinum ones. Yeah, I think we've seen rates that high.
Right,
but again, with ICHRA, just doing a little side tangent, when we're doing any type of calculation against contributions. For the ICHRA side, we're always looking at a lowest cost silver plan. And that's just the guidelines that were set in order to be fair for everyone. And the reason for that being is that it's most closely, in terms of structure, related to the group bronze plan. And by having that availability, because the bronze on the marketplaces, you're paying $9,400 deductible, whereas that's a crazy amount to expect. So you have those lower plans, which give employees that additional flexibility to pick something that's less, but we have to compare it to the silver plan. And contributions and affordability and ACA is all calculated against that.
Gotcha. And so there are a lot of moving parts to this.
A lot,
right?
Of moving parts.
And that's really where your expertise comes in. It's I mean, I don't know if there is any employer that tries to go at it alone with an ICHRA, but that would probably not be recommended for sure. But I think where you shine is the technology. And are you doing business in all states?
Every single state.
Every single state, and
Hawaii and Alaska included.
And there are differences state to state.
Correct.
With
county to county.
County to county. OMG.
Yes, county to county, different premiums, different rates.
And I know
costs.
that in New York, with our recent enrollment this past year, there were some questions about, and you're going to correct me, on exchange, versus
pre-tax,
off exchange,
post-tax.
pre-tax versus post-tax. And employees, needed to know, like, okay, is this plan election going to be put through payroll deduction and cost me 30% less, or am I paying full boat? And maybe you could explain that for anyone listening in New York, how that works.
Yeah, for sure. Well, first of all, what we try to do is we at the Big Plan, we try to create as close to a group feel while still being this individual coverage. So we are still handling everything with and through payroll deduction. But to answer your question, post-tax is on the exchange and pre-tax is off the exchange. So the tax incentives are built into the premiums and certain requirements to allow them to be on an on-exchange plan. And off-exchange are the individual policies sold by the carriers directly. So they're allowed to be on a pre-tax basis. In New York on its own, I believe there's only one carrier at this point that offers an off-exchange plan, and that would be Oscar.
Got it.
Right.
Yeah.
Yeah.
Yeah. I mean,
New York is different than all the other states because New York is not an age-banded state. So the rates are completely level. Whether you're 26 or 64, it's the same cost. Vermont is also a state.
Here to keep you honest.
Yeah. Vermont is also a state. Rates are fixed. Every other state, it's age-banded. So that 26-year-old and the 64-year-old, it's almost like
same exact plan.
Same exact plan, 1 to 3.
Different premiums.
Call it triple the premium, more or less, give or take. And when you can create contributions, because the one thing with ICHRA, it's not free for all. Just hey, do what you want to do. Go buy a plan in the exchange. An employer with over 50 employees still has to meet ACA requirements. You still have to meet affordability. You still have to not allow them to contribute more than 9.02% of their income towards the lowest cost silver plan, as opposed to bronze in the group market. And you still have to follow all these requirements. But if you just said to someone, hey, here's a $500 stipend. Everyone has an allowance of $500. Go buy any plan you want. How is it fair for her plan to be $300, mine $500, yours $600, and that one's $700, or whatever the numbers are? Mm-hmm. So we created a ratio that follows the ICHRA guidelines to make it the allowance based on age rather than just a flat amount. And again, consultants have a hard time digesting it. Employers have a hard time digesting it. But once the employee goes onto our system is sleek. It's cool. It looks amazing. And it's so simple.
You got a squirrel.
Exactly.
But it's so simple. You know what it is? You could be any type of worker and go on our system and it's clear. It's simple. KISS. KISS. It keeps it very simple. Stupid simple.
Keep it simple, stupid.
Keep it simple, stupid.
There
you
we go.
Keep it simple, stupid. My uncle always told me that's, you could be the smartest guy in the world, but keep it simple, stupid. And when you go to our website and that person logs in, the employer already elected the contribution. So they're going to see what their stipend is. And now when they look at their plans, they'll see what the original cost was and now what their net cost is after their contribution. And then you mentioned the post and pre-tax. It's something that we're very transparent with. The employer and employee have to understand a plan on the exchange is post-tax. A plan off the exchange is pre-tax. A lot of states have a lot of plans pre-tax too. New York is just runs differently than all the other states. So you go to Jersey, you could find the Horizon both on and off, I think, and some of the other plans.
New York and Massachusetts are historically
Forget Massachusetts.
the worst insurance
We try to stay away
states.
from
We
Massachusetts.
tried
even though we
very
have.
hard to stay away from Massachusetts. It's, again, when we try to treat it as close to group health, some of the states, they're basically saying, no, you need the individual involvement in this. We're
Right.
not giving you access to anything. They have to have some kind of ownership, and we understand that, and we're here to assist them as their liaison, as their advisor, but no, the individual has to do it. So Massachusetts, not a fun state to work with. We
No.
do work with them, but
Yep.
they have their own level of complexity that goes above New York.
Really?
Right, but if you go to Ohio, it's probably the number one state in
Ohio is a
ICHRA,
great-
Georgia, Illinois, Florida, California, Texas.
California, not so much.
Yeah.
The Blues are okay over there, but there are certain states that are really not a good ICHRA match. I mean, we just saw something with premiums.
Wyoming.
Wyoming was pretty tough. Alabama is interesting because Alabama is not a broker-friendly state. I'll tell you one thing, with all the insurance carriers out there, especially on the individual market, they're becoming more broker-friendly. They're understanding ICHRA is something to stay. There's companies like Centene and Better who's investing a lot of money into the brokerage world and just education about ICHRA. We're actually going, not Batya and I, but myself and a few others from the team are going to a show in Florida in the nursing home industry called ECAP that Centene has sponsored us to go. And they spend tens of thousands of dollars for us to go there, really to educate consumers about, employers, I should say, about ICHRA. And you got the Blues. We get calls. We just got a call from New Mexico Presbyterian calling us to want to partner with us. Hey, can we use your platform? Cigna, can we use your platform? All these companies are coming and saying, hey, one second, this is something that's real.
Yeah.
The penetration today in the exchange, even though there's, I think, 24 million, give or take, people that are on the exchange, and then you got the Medicaid as a different market, it's a very small number that are ICHRA.
Yeah.
Very small. It's just starting.
It seems like there's a lot of room to run for sure. And I'm not sure what your competitive landscape looks like. I don't think there are a ton of service providers out there like you. They're not all created equal, though, and I learned that, firsthand. I was going to say the hard way, but it's not that it was such a terrible experience. But I think it is important for our viewers and our listeners to understand that do your diligence. It's part of the process is test drive the platform.
Yeah, I mean,
how does it run? What are the fees?
I think a big difference, and there's some carriers out there, platforms out there that have a lot more recognition than us. I didn't raise 30, 40, 50, 60, 70 million dollars. I raised a few $1 million from friends and families, understanding that I know this business. And now it's taking it to the next level in terms of recognition and everything else. We know the insurance business, and I invested the proper money in technology so we could be at par with the competitors and then some. Because again, I'm not looking to be at par. I'm looking to be a step ahead. But knowledge is great. So having the experience and understanding what we know in the industry and what employers, employees, HRs are looking for, we've done. So I think we'll have a 98, 99% retention ratio. I think the feedback you'll hear from the brokers that work with us and the companies that work with us are thrilled. I can't say that for the first 3 clients we had.
Right.
So we're human.
Yeah.
We're learning. And I'll give a shout out to my buddy in Milestone, who was our first client that we rode here, Dovey Cohn, who I said, trust me on this one. And it backfired a few times for him. He called with some frustration. We still have him as a client. This is 4 years later.
Right.
And not only that, I think he probably doesn't want to expose how much he has, but he's got many, many employees and a lot of locations.
And they're happy.
It's a preschool business. He owns preschools around the country.
Right.
And it's worked. Took some learning curve. If you asked him, he'll say, "Oh," but is he happy now? I think I'm comfortable. I'm pretty sure I'm comfortable giving him as a referral.
Nice, nice. Well, listen. So you said a mouthful earlier. Whenever I'm speaking with a vendor or a partner, and they tell me you're not a good fit, that establishes credibility for me through the roof. If you have, a vendor or someone that you're looking at doing business with, and they advise against their solution, that's integrity, and that means a lot. Mm-hmm. And the other thing that I'll comment on is, as a healthcare consultant, we go in, and sometimes people hire us to do a project, and we're not looking at firing their broker and all of that stuff. We're just there to be an unbiased set of eyes. They pay us a fee for our service, and we go in and we evaluate what they're doing. We give them some potential options. And at the end of our analysis, sometimes the result is they do end up hiring us as broker of record. We had a very large broker that was in our client, and we won their business because they did not know about this strategy. And it just, for any broker that's listening, pay attention. You want to hold on to your clients, pay attention to everything that's out there in the marketplace. And this little, ICHRA, it sounds like a cold, but if you're not paying attention, you could end up losing a client. You could end up losing a substantial client.
It's my biggest pitch to brokers. And whenever we get there and we do seminars or trying to get broker relations with different insurance different brokerage firms, you might not sell it, know about it, understand it, propose it, go show them this option. Again, is it going to fit for a law firm? Probably not, unless they got a 49% increase.
Right.
Is it going to fit for this? Maybe not.
Right.
But if you don't bring it, someone else is, and guess what? We've already received broker of records, and we're seeing the change of like the brokers that are not educating their employees, their employer groups. They're losing the business.
Now, as a consultant, I have nothing to lose by sharing the good, the bad, and the ugly with my clients. And I have clients on Park Avenue that are investment banks that they're used to a silver spoon in their mouth when it comes to their benefits. This would not be a good fit for them, and I know it.
Right.
But will I mention it? Will I put it in a package as a strategy to consider? Will I spreadsheet it and show them their current trajectory versus the likely ICHRA trajectory, so that they can see the difference in the numbers, which always gets their attention? But at the end of the day, I know that they're not going to go with the strategy. They know they're not going to go with the strategy,
right.
But they could never fire me for not sharing the strategy with them. It's important. You have to do your business and do your job, right? At the end of the day, it's about doing your job.
Yeah. ICHRA has so many different tools that you could be creative with and really not just retain clients. You could approach potential clients. You could, it just has opened up a world to so many different areas that an employer is not thinking about, but you as the professional are coming to them and they're like, wow, that's a good idea. And that's interesting because in a situation where you have employers in multi-states, And let's just say there's one in Ohio and one in New York, and the New York group's just not the right fit for ICHRA, but the Ohio group is, that's okay. You're allowed to. There's different classifications for ICHRA. It doesn't work exactly like your regular group health plan. It's not management, non-management. 105H is different when it comes to discrimination. But when it comes to different states and other different locations, different tax IDs, different payrolls, there's different things you could do for them. And ICHRA is a really good remedy for the bleeding client, like you mentioned originally, as well as just someone who's initially offering health insurance for the first time. They don't know what the participation is. We've seen dozens of groups that are finally over the 50. They're mandated to offer health insurance. Who's quoting it if I get 4 on the plan? ICHRA, no participation.
Right.
So you can have 52 eligible employees with 2 on the plan. The broker doesn't have to alter the Excel spreadsheet. It doesn't. There's nothing that has to be changed.
Right.
And now you have an option. And then you could transition to fully insured or self-insured in the future. But for first-time people offering health insurance, it's a great way to test the water.
So I just want to jump in also and just say that one of the things that you're always going to get from us is full transparency over your groups. And one of the things that Carey did not mention when it comes to one of the benefits of ICHRA is that ICHRA funds can be used for Medicare reimbursement. So you can now actually, the employer on a pre-tax basis can contribute towards Medicare individuals to help them now purchase their Medicare and whatever they need for that to make them whole. And now they're getting funding for that. So they don't feel that all of a sudden they're losing something by going to this ICHRA. Now they are also receiving an added benefit by getting premiums paid through the ICHRA or reimbursed to them for their Medicare.
Awesome.
Yeah.
Pretty cool. Yeah. So, I kind of stumbled on the strategy when a group that I was managing just blew up. Their experience they got the highest renewal that I've ever seen in my career. So Blue Cross Blue Shield, they were with HIP before, Emblem, HIP, one of those two, and like 30% of their population in like 1 year, cancer diagnosis, HIV, all this crazy stuff. The renewal came in from Anthem. It was a proposal because they weren't the incumbent. The incumbent didn't want to re-sign them. Anthem came in, and the premium for family was over $164,000 a year. And so
I can't do the math.
And so the broker, not being aware of the ICHRA, didn't have anything for them. Now I was the broker at the time.
You're saying 164 for the whole group, or 10,000, like
164,000 family premium annual.
15,000 a month, in other words. Or
Correctamundo. Yes.
We just saw a group like that.
Yes, we did.
we just saw a New York group.
Yes.
Yeah.
I never saw this in my life. It was an Anthem group. It was a 14 or 15,000. The single plan was 44.51.
That was the renewal.
That was the renewal rate for the single. I'm like, what?
Yeah. No. So
By all means, everyone get a platinum plan.
exactly.
Still cheaper.
And give an ICHRA and give them $10,000 towards the deductible.
Right. So that's ludicrous, right?
Yeah.
That's a group that's not going to have insurance unless you're familiar and aware of a strategy like this, in which case the group went over. They're never looking back.
No.
I don't see them ever looking back. And so, the client is happy. The employees have affordable coverage. Are there some, negatives? Are there some people that are unhappy with the transition? Of course, always. Never promise rainbows and unicorns. Whenever the word C is involved, change, it's just bound to happen. But ultimately, the group is much better for it. The employees are much better for it. It really was a strategy that paid dividends.
Right. I think the more the consultant understands, because again, we deal with 5 to 10 different consultants a day, and some of them we get on calls with them, and they're saying something that's just not accurate. It's not going to be perfect.
No.
They're like, it doesn't. 99% of the carriers don't offer out of network. They're all HMO or EPO plans. There are a couple that have some PPO plans. I think in Florida they have a few, and a few other states, maybe California. But most of them are in-network only plans. They're local plans. They're not national plans. However, again, Ambetter, who's really making noise. Them and Oscar are making a lot of noise in the industry. Are looking to create or have created a national plan. Right now, I think Ambetter's in like 29 states, 27
Ambetter is
states.
now in 27 out of their 29 states. They actually offer national
You can
coverage. You
bounce,
call them
yeah.
and you say, hey, I'm in this state and there are Ambetter providers, and you get an authorization and you're actually able to see it on an in-network basis. Oscar also going on this trend where they're going to start offering, cross-county, cross-state line benefits. And I think that's tremendous for our clientele, because now when you have, those homes or those employees who live on the borders, and maybe they go to one hospital that's in one border and their doctor's on the other, they now have the ability, and we guide them to, again, we educate them. You're going to want to go with this plan. Now, Ambetter, I know of it. I know it's a very good plan. I know it's a huge marketplace plan, but the regular consumer has no idea who this Ambetter is, or has no idea what some of these odd carrier names are. And again, here we are to educate them, and here we are to tell them that this is going to be the benefit of taking something like this.
Right. Ambetter in New York is Fidelis. Same
Okay.
company. Yeah. People heard of Fidelis. Oh, isn't that a Medicaid carrier? Yes, it was. But again, transitioning, change.
Right.
I think employers and employees have to open their eyes to this new change in the marketplace. And yes, we're used to this group employer benefit. These are in New York. Here are the BUCAs, Blue Cross, United, Cigna, Aetna. It's expanding.
Yeah. Well, I think that's, just kind of winding down. I think that's the other piece of this, that your expertise really becomes vital, in my opinion, is just understanding who the network is, what hospitals are in network particularly. Even if you're in, United, which is the big giant gorilla, you may have a hospital that you want in the Freedom Network that's not on the Liberty Network. So if you go with one of these other plans that are a little, not United, right? They're more obscure. What does it mean for providers, and how do you help folks navigate that?
So our employee system actually allows the employee to go into it. They've allocated the contribution from the employer, and now the employee gets to input their physicians into our system. Our decision-making tool that we have isn't a preference. It's not to tell them this plan is going to guarantee your doctor being covered, but it's a financial analysis for that employee to say, hey, based on the scenario that you provided to us, this is going to be the most cost-efficient plan to you. Whether or not your doctors are in-network or non-network, it will notate in our system, 1 out of 1 covered or 0 out of 1 covered, and you can filter it out to do a preliminary research, seeing who is and who is not out of network, and filter out plans that have that doctor in network. Now, again, if you're seeing 8 physicians, is there one plan that's going to cover all 8 physicians?
Right.
There's no guarantee on something like that. But you can also pick up the phone ahead of time prior to open enrollment and say, hey, I'm looking at these plans. Guide me, give me an idea of what I know to look out for, so that I'm, again, being an informed consumer now when it comes to insurance.
You ever see Jerry Maguire?
Yes.
Sports agents?
Sure.
I'm going to be an agent for employees. Give that woman a raise.
She just got one.
Show her the money. She's good.
Yes.
She's good, Carey.
Thank you. Thank you. We appreciate Batya's talent. We know she's good. And, her communication, especially with the brokers, is her sweet spot.
Yeah.
And
No,
she's
excellent.
really retained a tremendous amount of knowledge in this industry. Like, when we started off 58 minutes ago, this conversation, she knew nothing about insurance when she started the career only a few years ago.
Right.
But
Look at her now.
Look at her now.
Look at her now.
And it's great. And the more people on the team that we have like Batya, the more I will not be.
There's only one
I'll
Batya,
be-
Carey.
I'll be
There's only one Batya.
Yes.
No, but I'll tell you something, that within the entire work atmosphere that we are a cohesive group, and we all work for each other, and we want to see this company thrive and grow. And this is why, if someone needs assistance in one aspect of it, we're jumping in for each other. We want to provide not only the white glove service to our brokers, our employees, our clients, but that same service we're providing in-house. And, we have our leaders who are instilling that upon us that, hey, learn from the ground up so that if something is needed, you're there to assist, whether it's, understanding the summary of benefits so that you can explain it to an employee who picked up the phone and somehow got to your extension. Everyone should understand every component to it so that you can explain it to everyone. And I think
there's no job too big or too small that no one can handle it. We're all willing to do it.
I can't do the tech.
I don't care. I don't care what our titles are. I don't care what anything else is. If you could step it up, then step it up. When it comes to enrollment time, hey, if I have to do an enrollment or put someone on, no problem. If Batya has to do it or the other 18, 15 people have to do it, let's do it.
Right.
Again, we have our positions, we have your focus, but let's be a team. And the big plan has really created a cohesive group. Great team. Communication is great. Again, we're not closed. We're not fixated. This is how I do it. And I feel like that's been very successful to say, okay, that's insightful. How do I bring that on? And that's what we do.
Yeah.
If we could do it, if there's what to do. At the same time, we're moving along with all the changes of the ICHRA industry. It's new. Laws are changing. Rules are changing. Anything being enforced? No. But our job is to be the knowledge base company that tells the employer, these are the laws. You want to break it, you can speed if you want. You can do whatever you want to do. But our job is to teach you how to do it right, be your partner in it, help your employees understand that your employees are the most important aspect of your company. You can't do it without them.
Yeah.
And you want to take care of them and not just say, hey, here's a few $100 and go find a plan. Great. How do you do that? Come to the big plan. Our white glove service will take care of them, treat them like gold, and treat them like we're dealing with the CEO of the company. And I think that's the feedback we're getting from our clientele.
Tell us again, Batya, how do people find you?
Oh, so you can email me at Batya, BATYA, @thebigplan.com, or you can reach us at hello@thebigplan.com. But I'm here for everyone, and I'm happy to even just have a communication piece that you can now give your clients. We've done webinars. We're happy to host those as well, but I'm here for all your ICHRA needs.
Yeah, and for all those consultants out there or all the employers that are listening to this, call your broker. Tell them to call us. You want to call us direct? That's fine. We're going to ask you who's your consultant,
Yep.
who's your broker. We work through brokers only. We don't work direct with the clientele. We're happy to talk to you, but we're going to get your consultant involved.
I'm just going to jump in on that because we had employers actually reach out to us directly and attempt to sign up, and we'll immediately pivot and we'll say, we need your broker involved. Our I don't even know what the word is, but basically our piece, our thriving is the relationship we have with the brokers, and we want them to understand we're not taking anything away from them. We're here to help you with everything involved in this. Whether you want to be completely hands-on or hands-off, we still need your involvement at one point, and we want that piece to continue and to grow as well. No doubt.
Well, hey, thank you both for joining us today. It's been incredible. And, to your point, I think there's a reason that brokers exist. There's got to be, you only have so much bandwidth as a solution provider. And if you're now fielding calls from every individual client that you have, that would be a logistical nightmare. But folks, do your diligence. I always tell, my clients, I tell my audience, do your diligence. Go check it out. There's a reason that you're in studio today. I know that you're legit. I vetted you, but I encourage anyone that's interested in, what is it, a QSERA or an ICHRA, which is the latest flavor, to go check out the folks at the Big Plan. Batya, Carey, thank you so much for joining.
Thank you so much for having us.
It's been a pleasure. And again, go to thebigplan.com and you'll find us.
Right on. Until next time, folks, peace and love always. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.